The largest healthcare worker strike in U.S. history, now in its second day, just the latest in a series of strikes to hit the American workforce. Tonight, 75,000 Kaiser Permanente workers in California, Oregon, and Washington are off the job. They want better pay and more staff. Workers say Kaiser has refused to negotiate.
Put patient first! Put patient first!
Safety, patient care. A patient crisis that we're in now because of short staffing, and we're asking that they fix that and they fix it immediately.
The less people you have doing the same job, you're making more money. You're still charging the same to your patients, but you're not paying the labor to do so, right? So it's hard. We're burning out. We're quitting.
For its part, Kaiser says when it comes to worker pay, it leads in every market it's in and has already agreed to a salary increase across the board. A lot of the issues stem from COVID burnout and staffing shortages. And while the strike is contained to Kaiser Permanente, this issue is playing out nationwide. It's no secret that, at least in part, what ails this country is a shortage of nurses. And it doesn't seem to be letting up anytime soon. An estimated 100,000 nurses left the workforce during COVID, and the Bureau of Labor anticipates there will be about 200,000 job openings per year over the next decade. So what will it take to get the Kaiser Permanente workers back on the job? We're standing by to talk with a key player in those negotiations. And the key question many are asking tonight: how is patient care being disrupted? ABC's Matt Gutman is covering all of this for us, and he joins us from Los Angeles, where Kaiser workers are on the picket lines for now a second straight day. Matt, we know negotiations have broken down. What's the status now?
They're really deadlocked at this point, Linsey. The negotiators from the union, who'd spent a large part of the past 6 months holed up in a San Francisco hotel and here in Los Angeles doing the negotiating with Kaiser, they've come back home to Los Angeles. So they're now waiting for a call from Kaiser, they say. But this is a serious deadlock at this point. That union rep also telling me that they're not exactly thinking that Kaiser has been negotiating good faith. That said, Kaiser overnight said it is committed to reaching a new agreement with the unions. They also said that they reached tentative agreements on wages for employees, increasing the minimum wage to $23 an hour here in California, $21 nationwide. And Kaiser has been quick to assure the public that patient care has not been compromised. They brought temporary workers in to fill the gaps. Still, the union officials I've been speaking with say that Kaiser has been trying to negotiate through the media. They have not actually seen any of those numbers on paper. And I spoke to one union member, Rocio Chacon, who was livid that they've been basically stood up by Kaiser in negotiations.
They did not show up to the table. And whenever they did, they would come into the room and talk for about 5-10 minutes. They would hear what we had to say and say, we don't have time for questions. Only to, of course, we would get, like, what do you mean? And that's why we're asking Kaiser executives to come and bargain in good faith.
And of course, the union is saying that it's waiting for a, quote, meaningful response from Kaiser, both on increased wages that would meet the rising cost of living and on what they call safer staffing levels. Of course, all of this remains to be seen, Linsey.
And what happens, Matt, at this point if the two sides can't reach an agreement in the coming days?
And that doesn't look likely at this point. The union is saying that they're going to come back, quote, longer and stronger. They're going to strike, they say, the first week of November, this time for 5 consecutive days, and that will put an even greater strain on Kaiser during those strikes. Linsey.
And Matt, stay with us if you can. I want to bring in Caroline Lucas, the executive director of the Coalition of Kaiser Permanente Unions. Ms. Lucas, thanks so much for joining us. This is, of course, the largest strike by healthcare workers. Of course, this, as you know, is, of course, the largest strike by healthcare workers in U.S. history. How did we get to this point?
We have been bargaining for months with Kaiser executives over the issues that our workers are facing in the Kaiser short staffing crisis. So frontline healthcare workers have flown from across the country to meet with Kaiser executives and share lasting solutions to this crisis. But Kaiser executives just aren't listening.
And let's drill down on some of those issues. Kaiser says that it's working on the staffing shortages and expects to reach its goal of 10,000 new hires by the end of the month. What's your response to that?
10,000 new hires is an important first step, but it really is just a first step. What those numbers don't tell you is that in that same time period, about 4,000 frontline healthcare workers in coalition represented jobs left Kaiser Permanente. So that just goes to show that while hiring is important, building a workforce infrastructure that sustains long-term employment is a critical component of a bigger solution.
And on the issue of pay, the company's proposal now offers an across-the-board increase and a schedule for raising their minimum wage over the next 3 years. How far apart are you on pay?
We actually do not have alignment on the across-the-board wage increase at all. We are looking for Kaiser to make a meaningful investment in the workforce infrastructure. What Kaiser has offered so far just falls short of what's needed to resolve this crisis, and honestly would leave workers further behind with the cost of living and the rising inflation than they were before they surged through a global pandemic.
And Matt, I want to bring you back in here. From your coverage of this story, is there anything else that you'd like to ask Caroline about?
As soon as this siren passes, yes. I mean, I think lots of folks are coming in here for elective surgeries, elective procedures. And while it is elective for them, it is important. It's also a huge inconvenience not to be able to make their appointments. What would you tell those patients, the thousands of them across the country during this strike and the possible one in November?
What I would say is the reason why our frontline healthcare providers are on strike is because the delays right now to schedule appointments, to schedule surgeries are weeks, even months out. And we have been sounding the alarm. Frontline healthcare workers have been advocating for their patients to hire more staff so patients can get in sooner and get appointments sooner. We are having overwhelming support from existing Kaiser patients who have called, emailed, showed up to our strike lines to tell us that they are overwhelmed and tired by the Kaiser wait to get appointments today. So we are out front talking to public about the Kaiser short staffing crisis because we want things to be better long-term for patients.
Certainly a crisis at this point. Caroline Lucas, Matt Gutman, we thank you both so much for your time.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.